Hey everybody, so y'all seem to like that last post that I did about back pain and sciatica and facet issues, so I thought I'd bring in the spine here and show you a little bit about the biomechanics of how that works. So starting with true sciatica, sciatic nerve is going to take branches all the way up from L1 down through the sacral nerves down here. Typically what will happen with true sciatica is you'll get pressure put on these nerve roots either from a disc issue or from an arthritic issue that's causing bone spurring coming through these holes here in your spine where the nerves come out, or could be happening just from inflammation. But what will typically happen with true sciatica is you'll actually notice pain that radiates below the knee versus facet syndrome. Now the facet joints are these little joints back here in the back part of your spinal cord, in the spinal column, excuse me. And in the lumbar spine, they're going to control flexion and extension. When these are the issues, you typically don't see pain that radiates past the knee. Now I say typically because there's exceptions to everything. But one of the things we look for clinically, outside of imaging, which we'd love to review with you, is if you're going to bend forward, hey, it's going to take pressure off of those facet joints and will typically make you feel better, versus if you bend backwards, you're going to compress those facet joints and that will increase your pain. So we literally have the patient bend forward, so it feels better. They bend back, makes it worse. You're probably dealing with a facet problem. Okay? On top of that, you also have the piriformis muscle, which the piriformis muscle is going to start on the inside of your sacrum here, and it's going to come down and hook to the outside of your femur here, and is responsible for external rotation of the hip. So taking your foot and moving it externally like this, that's the piriformis muscle. It gets tight a lot. We see this often where basically that piriformis muscle, in some people, your sciatic nerve actually goes through it. So if it's an issue, it's going to grab the sciatic nerve and cause sciatic symptoms, or it could compress the sciatic nerve against your hip if it's constricted. We see that happen quite often too. And on top of everything else, there might be abnormal joint biomechanics from an ankle that's not moving the way that it should, or a knee that's not moving the way it should, or a hip that's not moving the way it should, and it's throwing your gait off, and it's causing abnormal pressure happening on the spine. So those are the things that we look for. If this sounds like you, we'd sure love to help you out. Appreciate you watching the video. See you next time.